how do we diagnose obstructive sleep apnea syndrome? We have to measure the normal physiologic changes which is happening while we're asleep. This can be done in two ways probably. Those are the main two ways. Either we do the sleep test at home or we do the sleep test in the hospital. What's the difference between both of them? In hospital, there will be a sleep technician. He will come to you. He will place sensors on your head, next to your eyes, on your chest, on your finger, on your legs, to measure all these normal physiologic changes while you're asleep. This is called polysomnography. And then the technician will ask you to go ahead and sleep. And while you're sleeping, he will monitor your breathing patterns, your oxygen, your heartbeats, your all movements while you're asleep, and he will assess, is there any obstructive sleep apnea while you're asleep? If yes, he will take the right action while you're asleep. He probably will put a special mask on your face and special machine to help you to breathe correctly while you're asleep. So this is called polysomnography, which is done in hospital. While the other technique, which can be done at home, where a special machine will be given to you, very small one, smaller than any mobile, and you will carry it with you at home. You will connect it to a special belt, you'll put it on your chest, and you'll put it also in a special sensor to your finger to measure the heart rate and the oxygen, and you will have a special cannula, you'll place it on your nose to check the flow of your breathing. Then you turn on the machine, you go to sleep. In the morning, you turn off the machine, you bring it back to your doctor. We'll download the data which has been collected overnight and monitor how was your breathing, how was your heart rate, how was your oxygen, and analyze it to find if there was any obstructive sleep apnea while you're asleep or not. So those are the main techniques which help us to recognize underlying obstructive sleep apnea. But there's many physical examinations which may be helpful to predict presence of sleep apnea, and many sleep questionnaires which is very helpful to predict. Some of those, like Epworth sleeping scale, is type of questionnaires we ask for the patients to find what's his chance to fall asleep while he's driving, reading, watching TV, to assess is there any sleepiness or not. And some other types of questionnaires we ask the patient if he's snoring, if he stopped breathing. We name it as a stop pen questionnaire to assess is there anything to predict presence of obstructive sleep apnea or not. So to diagnose sleep apnea, we need good clinical history, good physical examination, and diagnostic testing.